As of now, I haven't been looking at clinicaltrials.gov recently, but what I saw last time I was looking, I think it might be 6 months ago, there is one study, I think it was on hold in the US by the Hoffman group. And I think what they want to do was to perform dendritic cell vaccines in CALR mutant MPN patients. But as far as I remember, they haven't updated the data recently. And he actually told me about this study 10 years ago when we met at the ESH in Estoril. When was it? Then back in 2016. And I haven't heard anything about that study. So they might have halted it. I don't know. Apart from that, but again, I haven't looked recently. I haven't heard of any vaccination trials in MPN. And now, pertaining to that, now at the current ESH meetings, where there were quite a significant number of top qualified persons, also in immunotherapy there in MPN, no one was really talking about vaccines. Everyone was talking about the bispecifics and the monoclonals, and of course the CAR T cells. So I think that there isn't much fashion in vaccination in MPN these days. I think that what we now want to see is that the more potent immunotherapeutic modalities, they have an effect in MPN, and then maybe from there we can learn something from that, and then go back and do vaccine studies again. I think for sure they have a potential to be curative. We know from those are case reports from chronic myeloid leukemia and also AML patients in complete remissions that were vaccinated with neoantigen or tumor-associated antigens. They actually reached a complete response and never had a relapse of their disease. So for sure, the disease is curable by vaccines. But as I also talked about at the ESH, my presentation at ESH, I think the main problem here is the tumor burden in patients with MPN.